With its own vaccine, Cuba by the end of this year will have all of its inhabitants vaccinated against COVID-19. Cuba has developed 4 vaccine candidates against COVID-19. 2 of them, Soberana 2 and Abdala, will enter their 3rd phase of clinical trials during these first days of March. Either probe drugs have tested their safety in thousands of volunteers in Cuba. In addition, 150,000 doses will be sent this month to Mexico following this 3rd clinical trial in the Central American country. Out of the 4 vaccine candidates, 3 of them, Soberana 1, Soberana 2, and Abdala, are intramuscular injectable vaccines, while Mambisa is a vaccine aimed to be nursed through the nostrils. These vaccines have showed a high immune response against the coronavirus and have also presented few mild side effects, such as slight pain around the injection site. To get a full immunization against the virus, a person will be required to get 3 shots of Soberana 2 vaccine once each fortnight. Meanwhile, Abdallah's vaccine demands 2 doses separated by a 3 weeks period. The republics of Iran, Venezuela, Vietnam, India, Pakistan, Syria, Italy, Canada, Jamaica, and Mexico, among others, have already shown their interest for these Cuban vaccines. Unlike Pfizer and Moderna vaccines, the Cuban ones do not require deep freezing nor any other special means of transportation out of the normal standards. So this makes the Cuban drugs a better economic option for poor countries. Before the end of this year, Cuba expects, and has already begun, to produce 100 million doses of the vaccine Soberana 2, looking forward to vaccinate its entire population of over 11,400,000 inhabitants and then exporting the rest of the vaccines, especially to the so-called underdeveloped countries. In addition, the government intends to donate the formulation of the vaccine to poor countries so that they too may be able to produce this immunogenic. Cuba has an experience of more than 30 years producing 8 of the 13 types of vaccines used in the country's vaccination prevention programs. For the PBCJ, Richards, direct from Cuba.